Olá, eu sou Filomena Ribeiro, estou aqui neste país maravilhoso, Moçambique. É um país enorme, é um país muito diverso, tem muitas etnias diferentes, 40 línguas falam-se aqui para além da língua portuguesa e apesar de ser um país tão rico, precisa de muito apoio em termos de saúde. Estamos aqui a acompanhar os Olhos do Mundo, que tem um projeto magnífico para ajudar esta população em termos de saúde ocular.
This summer, a team from the ESRS travelled to Mozambique to support and see firsthand the impact of programs we're supporting in sub-Saharan Africa. The team included Prof. Filomena Ribeiro, the president of the ESRS, Dr. Mark Wevel, and Tom Ogilvie Graham, also from the ESRS, and Dr. Carlos Moser, and Anna Barber from Eyes the World. The first stop was Mashish, the capital of Inhambane province, Mozambique. Mozambique is the 5th poorest country in the world, and Inhambane province is the 2nd poorest province. Inhambane is the size of Ireland and has a population of 1.5 million, and there are only 2 ophthalmologists. Clinics like these in Mashish are staffed by ophthalmic clinical officers and no ophthalmologists. However, they play a crucial role in providing eye care to the local population. Dr. Carlos Moser from Barcelona is the medical supervisor of the Eyes the World Mozambique program, and he regularly travels to Mashish and other parts of Inhambane province to train the clinical officers, consult and operate. Improving local eye care services is essential to improving equitable access to eye care, as if you can improve the local eye care services, you can reduce the travel expenses, which are a significant barrier to preventing the poorest of the people accessing care. The ESCRS team were able to see firsthand the excellent work being done despite the limited facilities available, the eye pathology being seen and treated in this clinic, and the great demand for the eye care services. The next day, the team travelled to Homoin, a region frequently devastated by cyclones and floods. The mobile optometry unit travels to different towns in the region to provide glasses. Uncorrected refractive error is the leading cause of visual impairment across the globe, and specifically in Mozambique. And local schools or clinics can be used to refract the patients, and their glasses can then be made in the van parked outside.
As medidas do quadro e do paciente.
Pode ser.
Depois que temos a lente aqui nessa máquina, é biseladora automática. Quando corta, sair o grande, estamos a limar nessa máquina. Essa aqui é biseladora automática. Sim.
Equity and access to eye care is improved if patients' travel expenses are minimized and if they don't have to return to get their glasses on another occasion. The team's next stop was Rio das Pedras, a rural town where they attended a community meeting convened by a village elder, and the meeting was being filmed by a local TV station. Gender equity in the community was being discussed. Despite women having equal rights, in reality, in this society, women suffer domestic abuse and are often not respected and are less likely to receive health care, including eye care, than men. In this poor community, health care has to be paid for from a family's limited resources, and as men usually control the family finances and are more likely to have paid work, their health and eye care tends to be considered more important than women's. This meeting was convened to discuss gender equity and access to health care.
Grande prazer estar aqui com vocês. Obrigado por me receberem na vossa comunidade. O meu nome é Filomena Ribeiro, sou oftalmologista, sou presidente da Sociedade Europeia de Cirurgia de Catarata.
She and Anna Barber, Executive Director of the Eyes of the World, were able to explain how important it is that women and men care for their eyes and get medical care if they have problems. It was a rewarding day to see the Eyes of the World facilitating important changes in the community. Back in Inhambane, the team got a glimpse of the future of healthcare in the province. Vasco from Eyes of the World gave them a tour of an upcoming project designed to enhance the quality of eye care for the local population. In the next 10 months, Eyes of the World and local organizations aim to have 50% of the new hospital operational. The initial phase will include facilities for various healthcare needs, followed by the construction of a modern operating theatre and administration buildings. Once completed, the hospital will provide a higher standard of eye care for the province and attract more ophthalmologists to the region. TV stations filmed the laying of the first foundation stone ceremony by the Minister of Health.
Isto é um ganho muito importante para a nossa província. E também, em termos de infraestruturas, estamos a falar de uma infraestrutura moderna.
Hemos conseguido los fondos para construir un edificio que nos permita trabajar juntamente con el hospital en un servicio de mayor calidad y mayor acceso a la población de Inhambane.
Finally, the team visited the ophthalmic ward at the main hospital in Inhambane, where they met the hospital ophthalmologists, observed surgery and toured the facilities.
Hola, estamos aquí en el Hospital Provincial en Mozambique. Hoy se hicieron aquí muchas cataratas, cirugías de cataratas, recuperando la visión a los pacientes y estamos acompañando.
Cataracts are the leading cause of blindness and visual loss in Africa. There's also a great need for well-trained cataract surgeons across the continent. International surgeons can provide valuable support, but the most effective way to combat avoidable blindness lies in training more local eye surgeons to be more efficient and to improve the outcome of their surgery through training programs. The ESCRS visit to Mozambique confirmed that grant funds are being used effectively. The value of supporting organizations like Eyes the World, who have had many years of experience doing excellent work in low-income countries, was confirmed. Together, we can improve the sight, health and quality of life of the people of Inhambane province in Mozambique. For more information about the ESCRS charity work or to get involved, visit escrs.org.